So I'm going to talk a little bit about body contouring. When I say body contouring, what I'm basically saying is trying to improve definition. It can be in the waistline, it can be in the arms, can be in the thighs, obviously the whole abdomen trunk area. And so we use a combination of excisional procedures, which is what you would think of like tummy tuck, where we're actually removing skin and plicating muscle. And then we also do liposuction. But instead of just traditional liposuction like we used to do, we incorporate body tight and Morpheus, which is the addition of radio frequency. So now we get skin tightening at the same time. So I'm going to show you a few examples here. This is a patient that came in early 20s, had not had any children, and wanted to have some contouring done. Basically wanted to get better definition within her waistline. Didn't feel like things fit very well. And so she's an ideal candidate for doing both the liposuction with the skin tightening. So she doesn't have a lot of skin excess that needs to be removed. And she hasn't had any pregnancies and is considering it in the future. So if you take this patient who has had a few children, she's in her early 40s, and her goal was to recapture and define her waistline. She wanted to get rid of the skin excess that was there and not have the outward pooching kind of her tummy. And she is not planning to have any more children. Okay, so when you look here, this is an important slide to kind of make the distinction of various areas where fat lives. So we have what's called subcutaneous fat, that's under the skin and above the muscle. It's basically anywhere in the body, but typically now we're talking about the trunk itself. So that means the area of the abdomen, the flanks. We tell people like clothes don't just fit in the front or on the sides or in the back, they fit all the way around, and we're really trying to cinch that in. So that's one area where fat lives. The other area where fat lives is basically what we call visceral fat in the viscera, and that's around your organs like your liver, intestines, etc. And I can't go after any of that fat. So when we talk about weight loss, weight reduction, etc., for somebody whose body mass index is maybe too high for surgery, a lot of times we're trying to get rid of that so that the overall circumference goes down and we can give them a better result. This is an important slide here because it's basically showing that if the skin is pinched together and someone says, well, they didn't get all the fat out where I had my liposuction. Well, the thing is that there's basically the outermost layer of where the skin is. So you've got the skin that's on the outside, and then you've got two layers of fat. You've got subdermal fat in this area here, and then you've got the fat that can be suctioned. So this is the deeper fat in this area here, and that's what we're going after specifically when we're doing the liposuction. And so the reason you can't take every single fat cell out is because there's a network of blood vessels that supplies the skin that's basically in this layer right here. So it's never like the back of your hand where it's just this wispy piece of skin that sits directly on top of, the tendons, etc. So that's basically trying to distinguish where the fat compartments are. When we're doing the tummy tuck, for example, you're actually having part of this removed. So the skin and the fat that's in there is being taken out. When someone comes in and they've got fullness in the tummy, they've had several children, for example, and they just feel like they're always pooching out no matter how many crunches, sit-ups, core work they do, they still, can't really see any improvement. All right, so if someone comes in again, they have a protruding tummy, they've had children, and they really want both a flatter and tighter tummy, they have skin excess as well, then we need to repair this diastasis and take out the skin excess. So the diastasis refers to the separation between the rectus muscles, which are basically like your sit-up muscles. There's one on the right and one on the left. And so they're connected up here at the rib cage, down here at the pubic bone. There are actually 3 layers that connect the right and left above the belly button. There's actually only 2 down lower. And the reason that's significant is because as pregnancies go on, the baby gets bigger, descends down into your pelvis. Now you're stretching out the area that's actually weaker than the upper area. And that's why when you look at someone from the side, they typically have more fullness at the bottom than the top. So in this shows basically what it looks like then when the muscle has been brought together. And so now you have fixed the diastasis, which again was that separation, which this really should show or should be labeled, is you have to have had some liposuction or something done in the flank area to get that nice definition that's there. So if you have any additional questions about the body contouring, if you're a candidate for the liposuction versus the tummy tuck, reach out to us and we will hopefully be able to answer your questions.